Find a table that has a rock on it, and those we'll ask you to gather around those tables. As well, if you are not planning to participate in the workshop on the First Nations Cancer Strategy, again, the other workshops are in, look to be all on the second level, so one level down. The other 5 workshops on rapid access to consultative expertise on specialty services, elder care and injury prevention, Men of the North, which is health and wellness for men, health as a business opportunities, communicable diseases, and of course this one here, session 1, First Nations Cancer Strategy. So given the time frame, we have an hour. Let us fairly quickly invite the panel to take their chairs, and we'll ask them to engage in this discussion. So as you see, we have the Chief Medical Officer, Dr. Evan Adams, is joining this presentation, and he's joined by Dr. Nadine Caron from UBC, and Pam Tobin, and Dr. Amanda Ward. And so with that, I'll ask you to wrap up your conversations, and I shall turn you over to the panel. So please give them a round of applause to make them welcome.
Thank you very much, Harold. Gosh, I hate how my ponytail looks on this camera. I'll try not to look at the monitors. Thank you so much for coming. Who doesn't want to do something about cancer? And certainly at the First Nations Health Authority, we hear from many of you and many people who are in communities that they would like to have their cancer journey improved. The cancer journey can be very, very long and complex. For those diagnosed with cancer, the aftercare can happen over a number of years. And for those who are being treated, the treatment can have many different aspects to it that are puzzling, that are complex and complicated, and that people find themselves in situations that they hadn't really quite imagined, and they're having to get through it. So we're hoping that with your help today, that we would start looking at the cancer pathway, or what is the path that we might follow for ourselves as patients, but also when our family members and our community members and our clients are going through cancer. So we have some paperwork, I think they're going around, where we have a chance for you to give us feedback. You have a chance to work with us for this coming several minutes to talk about the various aspects of the cancer journey you would like for us to touch upon. In other parts of the country, and we do have a representative here from the Canadian Partnership Against Cancer, in other parts of the country, First Nations, Inuit, and Métis peoples and caregivers are examining their cancer journeys and how it differs from region to region. I expect that the region that you're from, the cancer journey is different than in some other regions. And maybe even for your community, it's a very special journey compared to other communities. And maybe even for your particular family, the cancer journey is going to be different than from other families. So we do want you to be very personal, if you'd like to be, and to speak from your own wisdom and experiences while you're logging the various aspects of the cancer journey you would like for us to address. So you're speaking to us through your little placemats where you can take notes, and you can write all over it, you can write on the back, you can write on stickies, and you can ask us through the course of the hour to talk about parts of the journey that maybe you want to have more illuminated. For me, as the new Chief Medical Officer of the First Nations Health Authority, I do care that you feel supported over the many aspects of the cancer journey. I've had many family members who've had cancer themselves, and I very much appreciated when we had clinicians and researchers and organizers who illuminated that journey for them and for us. And I was very happy that we have very specific focuses or foci at the BC Cancer Agency and in other stakeholders that will help to support us specifically. We also know that we can get better. We're, in many ways, just at the beginning of examining these so that we can draw them up in a framework, to look at these issues and draw them up in a framework so that they're really specific for us. Do we have a video or no? We can have the video later. Oh, okay. All right. I'm looking for a slide to come up. Can we have the slide deck up? Tech people, is the slide coming up? Yep, thanks. There we go. Oh, we're going backwards. This isn't, there we go. Addressing gaps in the continuity of cancer care with and for First Nations, Inuit, and Métis patients. And you see all of our different logos on here. Because we participated together, all of us, from our various workplaces and the various things that we do in order to draw us all together. So today we would like to have an overview of the Canadian Partnership Against Cancer, which is a federal effort to re-look at cancer care across the country and try and improve quality of our services. We'll look at our goals and objectives, how we partner together, and then our work collectively, including our work today. So can I ask Pam to come up and to speak to these first slides, which are a description of the Canadian Partnership Against Cancer? Pamela Tobin.
Thank you, Evan. Thanks so much for having us here today to talk about such an important topic. As we know, cancer impacts most of us, and we are looking at ways to improve the cancer journey. And the one most important way that we can do that is by hearing voices of patients, families, and caregivers. So again, thank you for coming. I work for the Canadian Partnership Against Cancer, and I'm just going to talk a little bit about the work that we do on a national level and how we're working with BC and with the First Nations Health Authority in particular to improve the cancer journey for our First Nations, Inuit, and Métis patients across the country. So the Canadian Partnership Against Cancer, we're funded by the federal government. We have a 5-year mandate to improve the cancer journey, but we're looking out to 2013. So what kind of a difference can we make by 2030? By 2030. What kind of difference can we make in the cancer journey to improve specifically reducing cancer incidence, lessen the likelihood of patients dying from cancer, and enhancing the quality of life of those affected by cancer. So those are our ultimate goals, and we have 5-year mandates to make that happen. We'll hear more about our approach when we hear from Amanda, but we take a collaborative approach through 4 different ways of brokering knowledge, convening, integrating, and catalyzing. And very high level, all that means is that we do what we're doing here today, is bringing people together to hear about their journeys and to look at ways in which we can improve that journey for individuals, families, and communities. Here's another example of how we do it. So much like today, when we have everybody here at the table and we hear of people's stories and hear from people about how we can change the system, we bring together all of our partners from across the country, and we do this on a continual basis. So we do it at meetings such as this. We also partner with our national Aboriginal organizations right down to our community members and everybody in between. So it's really important that we follow that approach. And we'll hear more again from Amanda about how we're doing that here in BC with our partners through the First Nations Health Authority, the BC Cancer Agency, the Provincial Health Services Authority, and the Aboriginal Friendship Centres. So I will talk just very briefly about some of our work that we're doing, and then we'll turn it over and hear from you. So our largest initiative is our First Nations, Inuit, and Métis multi-year, multi-jurisdictional initiative. We have partners right across the country, and we're looking at how to improve diagnosis delivery and transitions in care, and every piece of the journey in between. So essentially all that means is that how do we ensure that we get a culturally appropriate diagnosis, and when we transition back to our home community, what resources are available to ensure that we have a successful transition back. We do, as we're doing today, knowledge translation and exchange meetings, because we can't make any change without hearing from individuals such as yourselves. We're starting some new pieces of work. Every meeting that we go to, we hear about the importance of looking at screening initiatives and how we can get people into screening programs earlier than later. We're looking at traditional health supports. There's only a few examples across the country of how we can have culturally appropriate traditional health supports available. So we really want to hear from people about what that might look like for them, whether it's being able to feel comfortable and safe having traditional medicines, whether it's bringing traditional food into the cancer center when you're receiving treatment, or any steps in between. Looking at patient identification and how to self-identify as First Nations, Inuit, or Métis, and how we may be able to do that in a safe way. And then finally, looking at evaluation and sustainability. Because our mandate's only until 2017, we want to make sure that the work that we do extends beyond 2017. So those are some things that we're looking at doing. And I'll stop there and before I hand it over to Amanda, but just to give you a very high-level overview. But I am here for the day. If anybody has any questions, happy to answer them, and I look forward to speaking with everybody when we have our breakout sessions. Masecho.
Good morning, everybody. I'd like to start by actually acknowledging those touched by cancer in the room today and showing appreciation for the stories that you're going to be sharing with us. As Pam said, I'm going to very briefly talk about the CPAC project and the part that we're playing in British Columbia and how this work is actually going to help to inform an overall First Nations Health Authority cancer strategy. So for us in British Columbia, the key is our organizations and partners. We've created a project team from the BC Cancer Agency, Provincial Health Service Authority, Métis Nation BC, BC Association of Aboriginal Friendship Centres, and the First Nations Health Authority. It is key that we strengthen these partnerships and collaborations and cooperate so that we can improve services through planning and integration of resources across the cancer care continuum. We also want to enhance cultural competency for healthcare providers by increasing the PHSA training uptake. And we want to increase patient awareness of supports and services by offering culturally appropriate brochures, guides, support groups, and patient navigators. Our focus in British Columbia is also on rural remote, since these communities are particularly challenged often with access and continuity of care. So we're into year one of our project, and as Pam mentioned, we are currently compiling a baseline report, which is basically information and data about cancer incidence and prevalence, Aboriginal patient identification, and the current resources and services that are available. We've created a quality improvement plan, and that's sort of the what, where, and how we're going to do things. But a critical part of this plan is engagement. And we've had several engagement sessions so far, and today is an additional engagement session for us to hear your voices in terms of understanding where the needs and gaps are and what we need to do to improve services. We were present at the Elders Gathering, and just this last week we had another meeting, a CPAC meeting, where we implemented surveys to ask those questions so we truly understand where those needs are. So in terms of the project, we hope that this is going to inform the overall cancer strategy. Cancer, whatever our connection to the disease, forces us to reflect on our own mortality. Cancer can affect us all, but access to appropriate services and care is not always equal, resulting in increased death from treatable cancers. In terms of the big picture, the solutions include ensuring that everyone has access and receives equitable and optimal care, and ensuring individual, patient-centered, holistic care that meets patients' needs. Access to, for example, culturally appropriate nutrition and medicine, acceptance of traditional practices, and spiritual needs. I'm going to stop now, and we're going to have a short video, but I really would like to thank you all for your contribution to these solutions and the knowledge that you will share with us today. Thank you.
All right, thank you. Did that strike a chord with anyone in the room? If it's not you, it's someone you know, it's someone you love, it's someone you heard of, or it's scared, it's going to be one of the above. You're scared it's going to be one of the above sometime in your lifetime. And that's the message that I hear frequently as a cancer surgeon here in British Columbia. Can I please ask IT to put the first slide up of the deck, please? Our goal for today is to engage in a dialogue, and as always, we started a bit late, and we have so much to say, and we're not going to come near to capturing all of your stories and your wisdom, but it's going to be a start. And that's one of the things we're going to stress today, is it's a start of what we hope is an ongoing dialogue to get your information and your expertise. By putting forward together a strategy, what we are asking for and acknowledging is that we need change. See, cancer itself is changing. Whoa. Cancer itself is changing. Some cancers are actually decreasing in incidence and prevalence. They're not happening as frequently. Some cancers are going the opposite way and increasing in incidence and prevalence. Some cancers are actually succumbing to the treatments that we've found out there, and they're actually becoming curable. Other cancers continue to elude patients and healthcare providers alike. The only thing is we don't know which, when, or where. One thing about change, when we're looking at how are we going to change how we approach cancer with the leadership of the First Nations Health Authority, is that it's not always comfortable, but it will get us closer to where we want to go. Winston Churchill said one thing that I love this quote: "To improve is to change. To be perfect is to change often." Now, if there's anyone that does not believe in the concept of perfection, that is me. I don't. No institution, no person, no individual, no group is perfect. But certainly, if you change when you notice when things are not perfect, and you make those adjustments, and you're fluid, and you're flexible, and you move around the barriers or over the barriers, and sometimes through the barriers, then you're certainly going to get to where you want to be closer. Between a group of us at the FNHA, many of them are not only on the stage here, but throughout the room and ready to help us with our breakout sessions, we came up with this analogy of the river that you see up here. And those are sort of big boulders, small boulders, and sand in the river. And you should have some placemats with you now in front of you that we're hoping that you feel comfortable writing on, scribbling on, jotting down your thoughts throughout the dialogue later this morning. A river reflects our analogy, first of all, our connection to the land, obviously. But one of the things about water is that it's always changing. When you look at the surface of a river, the water looks the same, but it's never the same. It's always slightly different or significantly different than what it was just a moment ago or a week ago or a decade ago. And with time, as the water moves over those stones, the boulders can actually become smooth or smaller or even move. The pebbles within the boulders can actually tumble with the current of the river. And the riverbed is always there, but it might be different. It might even dry up, but we know it's solid ground on which to stand. There are 5 major components of the strategy that the FNHA has put forward so far as a skeleton. And I stress as a skeleton because this is one of the things that we do with change. Sometimes you need to make sure you know that you're going in the right direction. And so if there's something that's missing, a different element, please feel free to add that onto your sketch or share it in the dialogue. Starting on one side there, with no particular reason, left or right, middle, is living well. Sometimes it's the wellness model that is so emphasized at the FNHA. I have to say, as a physician, I don't see much of this. And on days, I can go an entire day without seeing any of it at all. See, I'm downstream from all of it. As a surgical oncologist responsible for cutting out tumors or doing surgery to diagnose tumors, I don't get to see the upstage, the people who are doing the proactive, healthy choices, that are doing the screening mammograms or the FIT tests or the colorectal screening, et cetera. I don't get to see that. But I know it's out there, and I know that I need to work on it just as much as anyone else in this room, and it's an ongoing reminder for me. The screening movement, or early detection as it's referred to here, is certainly something I'm very, very passionate about, partly because this is where my research and some of my advocacy work is, working with the BC Cancer Agency, but also, more important, on a weekly basis, I unfortunately see the impact. I see the impact when there's a patient that comes to me who is diagnosed with breast cancer, And I can see the difference between if it's picked up by a mammogram or if it's picked up later down the road. These screening tests aren't perfect, but they're out there for a reason and they have great impact. What impact? Well, the early detection, definitely. But that early detection can change the type of treatment you need, the duration of the treatment, the frequency of the treatment, your need to travel, a lot of the things that we saw in that video. The other important thing is it can improve overall survival so that cancer becomes something that we call a chronic disease, something that we have, that we carry with us, but it's something that we've mastered and we have control over. And finally, what's often not known about screening is that it actually can kind of fit into that first one in terms of wellness, because it can prevent some cancers. Examples, mammograms can not only detect breast cancer early, but you can actually prevent it if it finds precancerous issues. Or FIT testing and colonoscopies can find polyps that, if they're found early enough, can be prevented from turning into cancer. HPV vaccinations or pap smears can not only prevent late diagnosis of cervical cancer, but can have a preventative role as well. All of these are important because those three examples are actually by the BC Cancer Agency under the PHSA screening programs. But for some reason, we struggle to meet the goals in terms of getting our people to have these screening tests. And why? I think that's one of the things we need to change. We need to find out why. And I think this is one of the areas where our people can actually be leaders, because it's not just a First Nations issue. It's a Canadian issue. It's an American issue. It's a North American issue. It's a European issue. These screening tests aren't used to the degree that are optimal. And I think First Nations people in British Columbia can be leaders in this area and have people turn to us and wonder, how can we have such engagement in this? The next one would be not only improving cancer care, but already, as Pam alluded to, and Amanda, is the fact that cancer care is not just surgery and chemotherapy and radiation, but it's recognizing that it has to be, without a shadow of a doubt, with no room for negotiation, culturally competent. In fact, I would aim for dropping the competency adjective out of it completely, and we stop accepting that as the bare minimum. But we aim for something bigger and better than competency, but at least getting to that level for all of our peoples, I think, is very, very important. And that all cancer care is in a culturally safe environment, a culturally sensitive environment, a culturally aware environment, and simply cultural. So you can have a cancer agency or a site that has a place for smudging. You can have traditional foods when you're going through that. You can have a healthcare system that recognizes the need for support that's not just financial. And finally, of course, it was a traditional medicine entity that was brought up by Amanda and Pam. That's cancer care that's completely out of the realm of what other people would be talking about at national organizations for cancer, because we hold that expertise and we hold that wisdom in our elders today. How do we capture that? How do we protect it? How do we use it? And how do we make it ours so that it is not judged and not put at risk? Finally, the last one that is up there, or no, there's two, creating impactful partnerships. One of the things about partnerships is I think we've all witnessed partnerships that are successful and partnerships that were probably doomed to fail right from the beginning. How do we create an impactful partnership, and what do we want out of it, and who do we want them with? Those are some of the questions that we're hoping for input from you. Respect, reciprocal, relevant. These are kind of things that would be important. The BC Cancer Agency and the PHSA would be natural partners, among with all the others that Pam and Amanda referred to. But, you know, Leslie Barley is in the room right here. Leslie's worked for the last 2 years, Leslie, to work with the interim CEO, Nick Foster, at the BC Cancer Agency, and just announced about a week ago a director of Aboriginal cancer care provincially for the BC Cancer Agency. And I think that's a huge step forward. Thank you. And so those are the type of partnerships that we're looking for, and we love your ideas and your thoughts on who else can we bring to the table, not only in BC, but outside of BC, not only Indigenous, but outside of the Indigenous spheres, who can we engage? And finally, looking at the last one, surveillance, research, and storytelling. You've heard all these words before, surveillance in terms of evaluation. CPAC's doing a great job with that. Research, right in front here, we have Malcolm King, the scientific director for the Institute of Aboriginal People's Health at CIHR, who leads Aboriginal researchers and helps us do the work that we need. How important is research? I don't do anything as a physician, whether it's a prescription I write, to the surgery I do, to the instruments I use in the operating room, to the statistics I tell my patients. That wasn't based on some research doing some work somewhere. But how do we make sure that the Aboriginal voice, the First Nations voice, is at those tables? That those numbers refer not just to someone else, but to our peoples, so that that solution ensures that it applies to not just the general Canadian public, to us, our communities, our loved ones. And finally, storytelling. I think we all understand that best of all. My favorite quote by Thomas King is, "The truth about stories is that that's all we are." Forget the statistics in this point. Forget the research, the surveillance, the medical tests. It's the stories that ground us all. I'll leave you with one final quote, because we're asking for a strategy, and this is hard, because strategy involves change. Change takes time. Time can be hard when you're under the pressure of seeing someone you loved right now with cancer. And sometimes the change won't happen in a timely fashion, but one of the things is it will happen if we put the passion and the commitment behind the strategy that is involving everyone's solutions. So that quote is this: "A society grows great when old man or old woman plant seeds for trees in whose shade they know they'll never sit." Plant seeds for trees in whose shade you'll never sit. But if there's anyone that knows the importance of generations, generations to come, I know that we'll all feel very comfortable planting seeds and starting today. Merci, miigwech. Thank you so much for coming. We sort of started and went on really, really quickly here. So that you know who's at the front of the room, we're going to do a reverse order of the introductions. Pam Tobin joins us from Toronto, but has her roots in northern British Columbia over the last few years, working for the BCCA Centre for the North, and is now with CPAC, the Canadian Partnerships Against Cancer. Amanda Ward has now joined the First Nations Health Authority and has a really long title, but involves the research and is the lead for the CPAC, or the Canadian Partnerships Against Cancer project, with First Nations and the FNHA here, along with Métis and Inuit. Of course, we all know Evan Adams for the multiple roles he plays. I won't call him Thomas, but yes, Evan Adams now is the Chief Operating Officer for the First Nations Health Authority, and whatever strategy we pass on to him, I have no doubt that he will do his ultimate best to ensure that it gets implemented so that there is shade and trees for generations to come. How are we going to get there? In front of you, you have those placemats with those stones. I stress again that those are just examples. It's a skeleton of a strategy, but it's not the classic ones where you see A goes to B, goes to C, goes to D. What we're going to ask you to do is at each table, there's a stone. With the stone, you've been randomly assigned one of those stones that's actually on the placemat. We'd ask you in your group to just talk about and have a discussion about that stone and jot down any notes, any ideas, any solutions, any questions that you have about that one particular stone area or one pillar. If there's an area that's missing that's not up there, feel free to bring that up in your discussion as well. And then we're going to have people circulating throughout the room and hopefully even members from the FNHA at each table to help transcribe this. And we're going to have people capturing all of your information. If you, at the end, decide to leave your placemat, it will be a sort of an implied consent that you don't mind us using your placemat to make sure that we've captured as much as we can people's thoughts and ideas. If you don't want to leave it, take it with you. If you don't want to leave it because you just love the work you did and you think it's amazing, if you can let us know, and then maybe we can communicate with you. You don't need to leave your name on it, but feel free to leave your name on it if you want to. And most importantly, if there's something that comes up that you want an answer to, that you need more information, that you'd like to talk to someone about, then please leave that question on the back of your placemat when you leave with your contact information, and we will get back to you about that so that we can have a further dialogue. So we'll now let you break out into groups. If you feel like you're at a table where there's only 3 or 4 and you'd like a bigger group, feel free to now sort of move around a little bit. But it looks like to me we've got some tables that mostly have at least 3. So we'll leave it to you in terms of if you think you have enough room at the table or enough people at the table. Any significant questions before we get started? And then we'll start roaming the room. All right. Looking forward to hearing your thoughts. Thank you so much.
Oh, hi, everyone. Thank you so much for sharing your stories and thoughts and ideas. It's time for us to wind up. I know I can't believe how quickly the time has gone, but lunch is being served, and we expect quite a large interruption at any second of a whole bunch of people with plates. We would like very much to collect the materials that you produced for us. If you could, if the monitors in the room could go around and start collecting those very precious materials on our behalf. Thank you. If you could hold them up in the air, then we know to come and collect them, and that way we won't take your own personal notes. If you could hold up the placemats that you want to hand in, that would be great. And again, we thank you so much for your efforts and work and time today. There are copies, blank copies of the placemats if you want to take them home with you. There are blank copies available if you'd like them. Just put your hands up and we will bring some to you. And if the monitors could go around and collect materials as quickly as possible, please, because we're having an influx of people as we speak.
I'm going to make a joke about you, by the way, as I always do. All right, so we bring this workshop to a close, and I'll ask you to join with me in thanking Dr. Evan Adams, Dr. Nadine Karan, Dr. Amanda Ward, and Pam Tobin. It's also my custom to try to find a witty remark to say about Evan Adams. And today, doesn't he remind you of Caesar Flickerman, the host of the Hunger Games? All right, so lunch is available. Please help yourself to the buffet. At about 12:25 or so, we'll ask the King and Queen for the Elders Gathering to come up to address you briefly.